Hello students, this is Professor Lopez coming to you with another pharmacology video. Today we are going over alpha-1 blockers. As with any medication in pharmacology, we're going to cover the 5 key components, that being the suffix or medication name, how we can identify this on an exam such as the NCLEX. Number 2, the mechanism of action. What does this medication do to achieve its therapeutic results? Number 3, what disease processes does this medication treat? Number 4, any side effects associated with alpha-1 blockers? And lastly, what type of education does the nurse need to provide to this patient to provide safe and effective care? Prior to us jumping into this, guys, I would like to ask if you can to like, comment, subscribe if you enjoy content such as this. With that being said, let's jump into alpha-1 blockers. Beginning, like I stated, we are going to start with the suffix, as this medication has a common suffix amongst the medications in the category. That suffix being osin, O-S-I-N. Some examples include prazosin, which is the prototype medication for this classification. We also have doxazosin, tamsulosin, terazosin, alphazosin. When you see osin, I need you to make the clarification that this is an alpha-1 blocker. Being able to identify it allows us to then learn what this medication does. Alphazosin, terazosin, tamsulosin are all alpha-1 blockers. Now, how do these medications achieve their therapeutic effect? In the name, it states its mechanism of action. These are alpha-1 adrenergic blockers. They block adrenergic receptors, specifically alpha-1. Alpha-1 receptors are normally on the receiving end of catecholamines, such as norepinephrine, which, as we know, promote vasoconstriction, an increase in heart rate, and an increase in blood pressure and respirations. By blocking these medications, alpha-1 blockers thus block these catecholamines and promote dilation and shrinking of certain smooth muscles, specifically the prostate. I emphasize the prostate because one of the main treatment disease processes for alpha-1 blockers are enlargement of the prostate. So to recap, alpha-1 blockers block alpha-1 receptors, thus promoting dilation and relaxation of smooth muscle. What disease processes do we utilize alpha-1 blockers for? As I just stated in the prior subcategory, we use it for enlarged prostates, such as with benign prostate hyperplasia. We also utilize this for hypertension. This is not a first-line hypertensive medication. I want you to circle and highlight that. This is not a first-line hypertensive treatment. The main treatment, though, is, as I just previously stated, is enlargement of the prostate. This medication, I like to emphasize as well, that it's safe to use in your renal populations, your diabetics, and your COPD patients. Side effects. What side effects do patients elicit when on alpha-1 blockers? The first side effect I always like to emphasize with any medication that can possibly treat hypertension is the potential for hypotension. Any medication that drops blood pressures can unfortunately drop them too much. So we need to monitor our patients. If that blood pressure is anywhere near or below 90/60, we are to alert our providers and hold the medication. Alpha-1 blockers specifically are correlated with orthostatic hypotension, so postural hypotension, as well as the first dose phenomenon. As spoken about in other videos, we know that the first dose phenomenon is episodes of orthostatic hypotension and syncope when the patient takes its first dose or within about 6 to 8 hours of that first dose. This is usually a target of higher level questions. And what, as a nurse, are you going to do to prevent this? The key pivotal education is to alert the patient to take this medication at night. By taking it at night, we are avoiding the first dose phenomenon and promoting safety. The third side effect I would like to alert you guys on is sexual dysfunction. Alpha-1 blockers, by relaxing smooth muscle, can promote impotence and decreasing sexual function in male patients. Lastly, the last two, they're not key side effects that pop up prevalently, but I would like you to know the incidence of tachycardia and vertigo when taking alpha-1 blockers. That wraps up alpha-1 blockers class. Alpha-1 blockers are pretty straightforward as they all end in osin. They are utilized in hypertension and benign prostate hyperplasia. You need to educate the patient on things such as first dose phenomenon and orthostatic hypotension. As we end every presentation that I have posted, we are going to do two NCLEX style questions, one being a multiple choice and one being a select all that apply. I always recommend, class, that you pause the presentation and read the question and choose your answer prior to me saying the answer. Let's jump into this first question. A client with hypertension and benign prostate hyperplasia is prescribed doxazosin. Which of the following statements below would the nurse emphasize regarding doxazosin? Weigh yourself daily and report any weight loss to your prescriber. B. Increase your potassium intake by eating more bananas and apricots. C. Impaired taste associated with this medication usually goes away in 2 to 3 weeks. Or D. Be sure to lay down after taking the first dose because first dose may cause hypotension and may make you dizzy. If you chose D, that is the correct answer, as this is specifically referring to the first dose phenomenon. Remember, with the first dose phenomenon, we want to encourage our patients to take it at night prior to bed. The first three choices do not directly relate to alpha-1 blockers and are not true, so neither of those are correct. The last question we're going to go over is a select all that apply, specifically pertaining to alpha-1 blockers. This question states, a client is diagnosed with benign prostate hyperplasia and has been prescribed tamsulosin to assist in urinary frequency. Which of the following side effects will the nurse reinforce regarding this medication? Is it A, take the first dose in the morning? B, monitor your blood pressure while on this medication? C, impotence is a potential side effect while on this medication? D, this medication is safe to take with your COPD? And E, monitor your potassium regularly while on this medication. Now again, I recommend that you pause and digest select all that applies so you can achieve the correct answer. Let's break down each specific choice and say if it's correct or incorrect. A, take the first dose in the morning. That is not true. We know that this medication should be taken at night to avoid the first dose phenomenon. B, monitor your blood pressure while on this medication. That is true. This medication can be utilized to treat hypertension. C, impotence is a potential side effect while on this medication. That is true. Impotence and sexual dysfunction are potential side effects with alpha-1 blockers. D, this medication is safe to take with your COPD. That is true. COPD, renal patients, and diabetics can take alpha-1 blockers. And E, monitor your potassium regularly while on this medication. That is not true. Potassium normally pertains to things such as ACE inhibitors and diuretics. So the answer should be B, C, and D. That concludes our presentation regarding alpha-1 blockers class. If you enjoyed this breakdown of alpha-1 blockers, feel free to subscribe and like below, and even recommend any medication classifications you would like me to emphasize. I will see you next time.